Welcome back, friends. Developing herd immunity is considered by many as one of the best ways to fight coronavirus. Many people believe that as time passes and the lockdowns get lifted, people mingle amongst each other, they develop a herd immunity, and that is probably the best way, long term measure to fight coronavirus. They develop antibodies, and that antibodies helps in preventing further infections from taking place, and also in uh, uh, further trying, further attempts to control the spread of coronavirus. Researchers, however, from Imperial College in London have screened 365,000 people in England over three rounds of testing between June 20 and September 28. And analysis of finger prick tests carried out at home found that rather than people building immunity over a period of time, the number of people with antibodies that can fight coronavirus have in fact declined roughly to 2.6% over the same period. Okay. So the React 2 study, which is not yet been peer reviewed, found that 6% of those tested had antibodies to the virus when the UK's lockdown measures were relaxed over the summer. However, by the start of the second wave of the cases last month, this figure had fallen to 4.4%. This very large study has shown that a proportion of people with detectable antibodies is falling over a period of time. According to one of the authors of the study and the professor at Imperial College London, Helen Ward. Now, we don't know whether this will leave the people at the risk of reinfection with the virus that causes coronavirus, but it is essential that everybody continues to follow the guidelines to reduce the risk to themselves and also to others. The findings suggest that there may be a decline in the level of population immunity in the months following the first wave of the coronavirus epidemic, potentially dashing the hopes for those who are calling for a controversial herd immunity to develop amongst the population. Earlier, we found that herd immunity occurs when enough of a population is immune to a disease, making it unlikely to spread and protecting the rest of the community, according to Mayo Clinic. It can be achieved through natural infection when enough people are exposed to the disease and develop antibodies against it, and through vaccinations. Health experts estimate that around 70% of the population would need to be vaccinated to have natural antibodies to achieve herd immunity. Some epidemiologists have suggested that aiming for herd immunity would be a better response to the pandemic than lockdown measures. Many others, however, have sharply criticized a strategy that would require vulnerable people to shield at home while the virus spreads amongst the young and the healthy. Earlier this month, we had Dr. Anthony Fauci, the US's top infection disease expert, described that to let the virus rip through the United States population unchecked as nonsense and dangerous. To date, more than 43.5 million people around the world have contracted coronavirus, with 1.16 million related deaths, according to data compiled by the Johns Hopkins University. Now, the results of the React 2 study shows that a downward trend of antibodies in people of all age groups and all areas of the United Kingdom, but not in health workers. The decline was largest for people aged 75 and above, the study said, while the smallest fall was amongst those which aged between 18 to 24 years. Researchers found that a decline, and that is what is a cause of concern, because if you find such a big decline amongst the aged population and whom you're trying to protect and who are the most vulnerable, then it shows that something is not working. Researchers found that a decline in the prevalent antibodies may initially be rapid before plateauing. They cautioned that data on this was only now beginning to emerge. The study only measured antibodies. The authors said that it was not possible to determine whether the loss of antibody positivity would correlate with an increased risk of an individual being reinfected, since it was not clear what contribution T cell immunity and memory responses played in protective immunity amongst during the re-exposure. T cells, as you probably know, are part of the immune system that defends against specific foreign pathogens. The study shows that over a period of time, there is a reduction in the proportion of people testing positive for antibodies, according to Professor Paul Elliott, director of the Real-Time Assessment of Community Transmission Program at Imperial College London, and one of the authors of the study. Testing positive for antibodies does not mean that you are immune to COVID-19. It remains, however, unclear what level of immunity the antibodies provide or for how long the immunity lasts, according to Professor Paul Elliott of the Imperial College London. If someone tests positive for antibodies, then they still need to follow a national guidelines program, which includes the appropriate social distancing measures, getting a swab test done if they have symptoms, and also wearing face coverings and masks as and when required. Friends, this deals some kind of a blow to those who have been vouching for herd immunity, and let us admit it, herd immunity was turning out to be one of the important ways of tackling coronavirus, and therefore this study of the Imperial College London is definitely something which is going to be yet another study that shows that it is not going to be, the fight against coronavirus is not done and dusted with. Friends, this is the scenario which we are facing, whereas there is a lot of delay that is taking place in coming out with vaccine. At the same time, the herd immunity is also now coming under cloud, under question. Pfizer's late study into this coronavirus has now saying that now they've got enough volunteers for its phase 3 trials, which is pretty good. And they in fact, Pfizer late stage coronavirus vaccine trial has enrolled more than 42,000 volunteers, and the company has announced, and nearly 36,000 of the volunteers have already received a second of its 2-dose COVID-19 vaccine. Pfizer's late-stage coronavirus vaccine trial has, as I just said, enrolled more than 42,000 volunteers, and it says that 36,000 of the volunteers have already received the second of its 2-dose COVID-19 vaccine. Pfizer has been working alongside German drug maker BioNTech, as you know, on the experimental vaccine. It contains genetic material called messenger RNA or mRNA, which scientists hope provokes the immune system to fight the virus. In September, Pfizer had expanded the enrollment of its phase 3 trial up to 44,000 volunteers from the initial target of up to 30,000 to broad base it and to reach a larger cross-section of the population. The company said that the expansion would allow it to further increase diversity in the trial, as well as include adolescents as young as 16 years old and people with pre-existing health conditions. The phase 3 trials are the critical last step needed to get the vaccines cleared for distribution. 3 other US-backed candidates are in phase 3: Moderna, AstraZeneca, and Johnson & Johnson. Pfizer expects to apply for an emergency use authorization with the US FDA next month. Yet, the hopes are there, but there have been many interruptions in this, and we still do not have a clear-cut vaccine. At the same time, the study of the Imperial College London, which raises questions about antibodies and herd immunity, the immunity going away after some period of time, and you catch catching infection or the possibility of an infection is definitely raises question marks as to how soon we are able to counteract and control and get a handle over coronavirus, friends. So this is the backdrop in which we go forward, and from here, and in which this is the background situation in which we feel that the coronavirus is not yet under control, and we have reached an environment where rising coronavirus cases, second wave of coronavirus is on in Europe, in the United States, and in many other parts of the world. At the same time, a perfect cure is not yet found in the form of a vaccine. Not only that, now we have an added issue of herd immunity not working to the fullest extent as was desired. Thank you very much. Thanks for watching my video, and do subscribe to my channel if you liked my video, and do forward or share it with your friends as well. Happy investing. Take care.